As we get started this morning, as has been our custom, I wonder if we might take a moment in prayer. I'm going to pray from my tradition. I invite you to pray from your tradition. And if you have no tradition and God is not part of your mental mix, I ask that you send your positive energies to those where they're needed. So let us begin. Let us pray. Keep watch, dear Lord, with those who work or watch or weep this morning. Give your angels charge over those who sleep. Tend the sick, Lord Christ. Give rest to the weary. Bless the dying. Soothe the suffering. Pity the afflicted. Shield the joyous. And all for your love's sake. Amen. So Mike, welcome back. I will tell you that I look forward to this. Believe it or not, I really do. Blessed time with you. Just want to frame our conversation here. This is our 6th gathering. And as I have thought about the pandemic and with reference to the life of this church, and as I see it unfolding in the United States and around the world, I see it as an HBO or Netflix special. And season 1 was the pandemic, the crisis, and we booted up to a whole new thing, dealt with the crisis, learned a new language, ventilators, comorbidity, hospital beds, vaccinations, a whole new world for us. And now as we're 6 weeks into this, or at least 6 weeks from our church perspective, maybe 8 weeks from the country's perspective, where the country really started to steer into it, I think we're in season 2. And season 2 is Pandemic the Lifestyle, where we are beginning to question and wonder what it means to live with this pandemic through time. When we first began, we were talking about everybody needs to chill for 2 weeks, and then summer, fall, winter, 2021, the NCAA basketball season can begin. And now as I read and hear, I hear even 2022. So I wonder if you have any comment on Pandemic the Lifestyle and just the mega arc that we're talking about here.
Well, first and foremost, you and I have vastly different views of what entertaining television looks like in terms of seasons. I think you're right. I think we're past kind of the, if I could show a chart again that I showed, I think it was the first or second time I was here. The first time I was here, I think you would feel some relief in that we've actually compressed the daily rates of infection, but we've also dramatically increased the capacity in the hospitals, dramatically. And when I say dramatically, almost doubled. So,
wow, beautiful.
Let's be careful though. Beds, ventilators, everyone's focused on ventilators being the limiting factor. As things progress, manpower, womanpower is going to be the limiting factor. So I think, yes, we've compressed the daily infection rate and we've gotten it below the capacity of the hospitals, which is great, but we're still driving that car at 9,000 RPMs. It's still at a rate that's almost unsustainable. Yeah. So that's the urgency for us to continue to do what we're doing, because if we let off, our social distancing restrictions and we raise our daily infection rates just a little bit, it'll put us right back into a tailspin with the hospitals. So, and a lot has been done. A lot of unbelievable work has been done in the hospitals and the healthcare system to be able to handle this capacity. But again, you can only drive the car at that level for so long. So where we are now is we are at least beginning to put pen and paper together to figure out what it looks like to unwind this. It was never easy. It was never an easy decision, nor was it easy to actually follow the restrictions that were put on society. No one's wired to do this. No one's predisposed to wanting to spend all their time with their spouse, with their family, confined in a room with no outside intervention and no ability to actually interact with other people the way we've used to be interacting. So that's not normal. We get that. But still, there's a number of things that have to happen before we can actually fully re-engage or re-engage in some manner. So we've talked about the 4 big ones in the past. There's a lot that's happened in 7 days since I've seen you last with respect to testing. A lot of it's theoretical. We haven't seen it yet. So this ability to, for Abbott Labs to test 10 million people a day at some point in June could be a game changer. But again, that's sometime in June, and we haven't seen the reliability of the tests yet. I think the general theme of being able to open up segments of our society and surveil to maintain that level of daily infection rate to a level that we can sustain in the hospitals is really troubling because we don't have the surveillance capabilities right now with the few cases that we do have. So currently New Canaan has 147 positive cases and 19 fatalities. I took a day off, 2 days off from sharing it for a good reason. One, for personal salvation from my end and my family's, but also because I think the mental health experts have some validity in continually sharing the same bad news every single day. It's kind of demoralizing for everybody. So it's not to minimize the loss we had yesterday. It's not to say we don't want to talk about it, but it's just that I think people getting used to me sharing bad news at 7 o'clock at night at dinner is probably not the healthiest thing. So we'll try it. We tried to take 2 days off. I would likely be putting a message out tonight, not about the data, but just something different that we're going to do. But I think it's important that we understand that the surveillance of the community is going to be vital. And what that means is if we re-engage one portion of society, we've got to be able to monitor the increase in infection rates so we can either dial back or dial up the relaxing of the rules. And that's something that we've got to really struggle with because it's not something that we're prepared to do right now. So no one knows where the staffing comes for that. We are going to train up everybody we have in town to help Jen Eilson, our health director, be able to contact trace any positive cases. But again, it's going to be a heavy lift. Vaccines, I think everyone's carefully watching vaccines and therapeutics. There is some positive news of limited studies that have happened in the past week that show remdesivir being a positive therapeutic. We hope that that's true. And hopefully at some point the U.S. government will tell us whether or not those tests are actually a large enough sample size to make it a widely used therapeutic. That would be great news. Great news.
I think one of the interesting things about understanding our attack on the virus as war is that, World War II, we had to build engine parts for airplanes and things like that, and that was clearly a lot simpler in certain ways than ramping up and building vaccinations where the lab work and the amount of time it takes and the testing and is much more difficult here.
It's not just the identification of a vaccine that is effective. It's also how you actually administer the vaccine to everybody in the world at the same time. It's that in itself is a Herculean effort. Trust me, they're working on all that while they're working on the vaccine. But in some parts of the country, in the world, syringes aren't readily available. So, and you don't have the trained staff to actually administer vaccines. So there's a lot has to happen between now and when we have a vaccinated population.
Well, we also there are so-called third world countries or developing countries like Nigeria and Ghana where they do have distribution systems built into their government because they constantly have to contend with this.
They're better than we are.
Way ahead of us, and we, the so-called developed world, have no distribution system. So even if we have the supply, we don't have a way to.
So that's a fascinating point because. It's not just the vaccinations. It's just in our own country for years we've considered service workers. Now they're essential workers, right? The whole world's pretty much been turned upside down. So there's a lot we can learn from developing countries that have had to go through this iteration of vaccinations and treatment every couple of years because they know how to do it. It's different. It's definitely going to be a different science for us. Especially administering vaccines when you can't social gather. Right. So it's going to be it'll be a challenge, but one that we'll get through, and we'll probably get to the distribution solution at the same time we come to the vaccine solution, hopefully.
Yeah, one of the things we're learning is how interconnected we are as people, and I noted on the town call the other day. I think you were not on that call, but there was a question that came up about returning to school, and as we begin to have certain segments of the population re-engage. What about our youngest? And 2 points were made. One is the littlest kids would be great if they could go back so that their parents could get some work done and have some more sanity, which I laughed given that my kids are older. And secondly, the question of the younger population seems statistically to be able to bear the brunt of the disease. Mark Davis from St. Luke's, who was a very impressive man, who I've never met, but wow, said, hey, this isn't that simple, right? Schools, by their very nature, are social engagements. Social distancing isn't a possibility in a school. And then, by the way, we have staff and we have faculties who are adults, and kids are vectors, and then they bring it home. So this trying to release a segment of the population. Somebody I know's grandmother had said, well, this is like saying, okay, nobody can go to they got to keep this clean here. Nobody can go to the bathroom in the pool, right? And yet now we're saying maybe one end of the pool it's okay, right? But we are all isn't that beautiful? But we're all in this mix together. So how we begin to reintegrate into society, into normalcy, testing, all of this stuff, quite incredibly complicated.
Yeah, I'm going to take just a moment to think about that analogy. That's alarming, your analogy about the pool.
Well, it came to me, and I...
The whole idea of school is a challenge because you're right. I mean, you can't expect the workforce to go back to work if the kids are still home. And I think it's really important that children be in school. And, the things that I think about that I'm pretty sure someone else is also thinking about are, look at the educational disparity between the more affluent communities and the less fortunate communities. There's always been an education gap that we've worried about. Now, I can argue both sides of the coin that, this e-learning, distance learning, whatever we want to call it, is either widening that gap or it might possibly be narrowing that gap. I don't know. It's possible that if a certain segment of populations aren't attending schools, this might narrow the gap. But if everyone is going to school, but we've got high-speed internet in one community versus another where they don't, you might not have the same educational opportunities. Whatever the issue is, and again, Dr. Lutzy has done a remarkable job, our teachers do a remarkable job educating our kids. I don't think it's the same as the full experience being in school.
Yeah.
So, what you fear is you could lose a lost year. Everybody that advances to the next grade might not be ready for the next grade, but at some point the question is, globally, are we competitive? Right? I mean, China goes to school, full year. So do we take summers off? Mark is right. Schools are the anti-social distancing model.
Yeah.
But you could social distance in school. And the way you would do it is you would actually have two shifts, right? So you split the kids in half. And you have an early session and a late session. You have half the class size. You can spread out more in a classroom. I'm not suggesting that would actually improve the spread of the virus. It might, it might not. But you don't have the teachers to do it. And you don't have the hours in the day to have teachers teach twice as many hours. So these are all things that people need to work out.
Yeah.
I don't think there's anybody among us that doesn't want to get back to some semblance of normalcy as fast as possible. And I think the most important thing we can do is develop a system where we have some sense of the pulse of this infection rate, so that if we start to see things spiral out of control again, we can dial it back before it gets to a point where we have, the issue we had, over the last 3 or 4 weeks. And that's where we have the need, the demand in the hospitals exceeding the capacity.
Yeah.
So I mean, schools are a tough one. Daycare, preschool, schools, all in the same category.
Right.
And then you have, businesses. What does it take to get people back to work from a business? And if you can remote work from home, I think it's probably okay to continue to do that if you're effective, if you're efficient. Some businesses are highly efficient, not being in the same location. Some businesses rely on people to be in the same location.
Yeah.
Restaurants are also incredibly tough. Because if you think about a restaurant, I mean, the economic model of a restaurant is really a challenge in good times. And you got to think how many times you got to turn those tables in a night to break even. If you cut half the chairs in a restaurant to increase social distancing, I don't see any restaurant being profitable.
Yeah.
So, we got to think about what we want this to look like. And then, there's a lot of support, several $1 trillion of support flowing through the system. It's probably not going to where it needs to go. What happened with the first $350 billion of small business loans is it went to those who could manage the system the best. Those who had banking relationships were able to get into their banks and secure their spot in line. And it was a first come, first serve, provided you knew how to manage the system.
Yeah.
The next, $250 billion that comes through the system needs to get to those who need it. And there's no way for someone on a local level to manage that process differently. But we're trying to figure this out as we fly the planes. So it's a challenge. But I'm not certain, and others probably know better than I do, that the aid and the support is going where it actually needs to go.
Well, thank you for that. I just a word about that. I want to clarify that Mark was talking about the education system. The thing about the pool was all my doing. I don't want that to get associated with Mark. Okay, if it's associated with me. So what you're talking about here, we're talking about here some of the complexities about rebooting and restarting. If you look across the country, it's really very interesting to see what's opened up. I mean, I must tell you that I loved it that bait shops in Minnesota could be opened up. I thought, yeah, these guys, the guys and gals got to get out in their boat and go fishing. And you need the bait. So it is interesting for us in Fairfield County, for us in Connecticut, for us in the metro region. And so just want a word about that. So as I understand it, the governors of 7 states are saying, this is back to my pool analogy, we're not going to just do this, spottedly. We're going to say, okay, we're going to clean up this portion of the pool. We're going to move in concert. Do you know anything about that, or do you hear anything about that?
So before we get to the 7 states, and I think regionalization of this is smart because we're not a community that just sticks to New Canaan. We get on trains, go to New York, we go up to Boston. We're commuting, so something needs to be done, collectively among all the states. The whole idea of re-engaging society is about risk, right? So it really, if you think about it, it's really just about how much risk are we willing to tolerate. And I'll give you a simple example. In public safety, on the front lines, everybody should adopt the same philosophy that public safety adopts, which is that everybody you come in contact with, you, Jill, me, we're all infected. Assume you are all carrying the virus. We just have different stages of it, and some of us get sicker than others, and some of us are asymptomatic, but some of us just got over it, but we're all carriers of the virus. My wife, my kids, my employer, the police officer from the street, the paramedic, the person at the grocery store, everyone's infected.
Yep.
Okay? So once you come up with that, and the reason why you have to assume that is because the testing just isn't there yet to tell us if you or I are positive or not. So we have to assume they are. So that's why the 6-foot distance between you and I is valuable.
I increased it today. You may not even know. It's very subtly because I'm reading about that 6-foot
That's
thing.
why gloves, masks, hand wipes, that's why these things are so vital, because it reduces the spread if we're all assuming we're positive. Now, I'm willing to tolerate risk with my wife because we get home and we're living in our house, and that's a risk that I'm willing to tolerate because we live in the same house and we take care of each other. I might not share the same commitment to risk sharing with somebody I meet in the street for the first time and want to shake their hand. So it's just not wise, even though I can kiss my wife goodnight, I can't shake someone's hand on the street because there's no benefit to that. The reason why we tolerate going to the grocery store is because it's an essential service. So if you can get your food some other way without taking any risk, I strongly encourage that. If you want to go to the grocery store because you need food, you are accepting some level of risk, and we're doing everything we can, training, equipment, distancing, to maintain the lowest risk transfer possible. But it's risk. If you break your foot, you normally go to the ER to get an x-ray and get it set. You can do that. That's a level of risk. You might not do it now. You might put it in a splint at home and wait until this calms down and then go. Everyone's going to take different levels of risk. So when you re-engage society, the question is it worth the risk that you're taking? So that's currently. If we had widespread testing, we could tell you more readily whether or not all 3 of us in this room are actually infected or not. If we weren't infected and we trusted the test, we might be able to behave differently and tolerate more risk because the risk of infection will be lower. And that's the calculus that society's got to get through before we decide, is it, I love going to a football game. I'm a season ticket holder. I love it. But do I really want to risk my family's health or my parents' health or, some seniors I don't know or someone who's at risk because I like watching a football game? Again, we'll get to that level, but until we get better surveillance, better testing, better therapeutics, and a better vaccine, I suspect some levels of risk-taking are just going to be off the table for the foreseeable future.
Yeah.
So you asked me a question that I didn't answer. It was about the 7 states and how we're going to combine this. And I think, for one, I'm seeing the 7 states get together and urge the federal government to handle the testing component of this. And I think that's probably a smart idea. I think we've talked about this before. We've lived through, if you want to see a movie, not a very pleasant movie about acquiring personal protective equipment for the last month and a half. Just not pleasant at all. Everything you can think of as to why that was wrong is just evident every single day. And it should be something that should not be repeated in this country. You should not be competing for scarce goods that are life-saving with everyone else that's got ample resources to compete with you. It just is astronomically expensive, inefficient, and doesn't get the equipment to where it needs to go. It gets it to those who are most resourceful, which is really not the way this is supposed to work. Same thing with testing. So if Telluride, just to pick on a community, if Telluride, if someone owns a house in Telluride that's on the board of a testing company, I use Telluride because that's actually what happened, and they're able to test all 9,000 residents of Telluride, Colorado, with antibody testing, that's great. But is that where that resource is supposed to go? And that's what I think is going to happen unless we have a national framework for testing. So the 7 governors, is it 7? I think maybe it's 7. 7 governors on the eastern coast have all decided that this should not be a state-by-state or regional basis. So I'm glad that Connecticut's not competing with New York. I'm glad that Massachusetts is not competing with New York. I think collectively we should all have one national testing. And also the problem is there's different reliabilities of tests. So if we're all using different testing mechanisms to gather data, is the data all the same? Is it all weighed the same?
Wow.
And I think one of the things that you do in a crisis is you relax the authorizations that the FDA normally puts on things, so we have to use them widespread in the healthcare industry. So this emergency use authorization means all testing and all reliability is off the table, just do what you got to do. And we're seeing some pretty high fail rates in some of these tests. So
can you repeat that? What rates are you seeing with these tests?
Normally you need FDA certifications for certain medical procedures to be done and considered efficient, or the efficacy's got to be at a certain level where they're actually able to use them. When you have an emergency use authorization, everything kind of passes the test. There's no test. So you just flood the market with equipment, and that's why you can buy home test kits that are probably unreliable. I can tell you with masks, it was the N95 standard, was the mask you have right there in that green bag. That is the gold standard for masks. That's an 1860. That is the one that prevents healthcare workers from not just airborne, but also droplets. So that is the mask of choice for healthcare workers. Here's the problem. The CDC would tell you that in surgery, that's what you should be wearing. However, when you don't have them available, the CDC relaxes the guidelines to the point where pretty much anything, your bandana pretty much would pass the CDC test right now. And that's unfortunate because we know healthcare workers are not protected wearing your bandana. But the testing is the same kind of thing. So all these tests flooding the market, and they can promise 5 minutes, 7 minutes, that's great if it's accurate. But someone needs to actually take the time to determine if these tests are accurate. The only thing worse than going through all this process of testing 300 million people and finding the tests aren't accurate is kind of crazy. So we've got to figure out if they're accurate, and we're not there yet.
Wow. Okay. Complexity upon complexity here. Let's talk about masks here for a second. So I brought out N95, catches 95% of the particles.
Not only that, let's talk about price. Okay. Let's talk about price for a second. So hold that up. That's an N95 made by 3M. It's a model 1860. That's the standard size. Or maybe that's a small. I can't tell from here. So that mask pre-COVID-19 is 50 to 90 cents a mask in bulk, depending on how many you buy. I've seen them trade as much as $12 a mask in quantity on the West Coast. And right now, we could probably buy those for $5 landed here in the U.S. if you can get them. Okay, so that's that mask. The surgical mask you're holding, that's a simple ear loop surgical mask. That's good for average citizens walking around. That mask keeps me from getting sick from you, not you getting sick from me. Because that's a respirator, that's a mask. That mask, 2 to 3 cents to make pre-COVID. You're spending 60 to 70 cents a mask right now to buy those now.
So just repeat this. So this means that I'm not making you sick.
So if you wore both those masks and you exercised, you'd feel a very different response in your body. So that mask, you're getting full oxygen through the sides and through the mask. It's not stopping or impeding your oxygen intake, your air intake. That's a respirator. That if you exercise in that mask, you'll feel lousy. So that's why that mask is not normally used for the public. Here's the problem with masks. The problem with masks are, we still have a very short supply for our healthcare professionals on the front line. So they need to be continued to be used almost exclusively for the front lines. They also give you a false sense of security. So one of my concerns with giving masks out to the public, if I give you a mask, you're going to say, great, I'm protected, I can go out and do what I want to do. You go back to playing golf, playing tennis, walking the tracks, playing soccer, you can do anything you want in a surgical mask, that's not going to hurt you. But you're not protected. And it does slow the spread. It's not going to protect you. So again, those masks need to be reintroduced into society at the appropriate time, and people need to understand just because you have it doesn't mean you're perfectly safe. So the town of New Canaan, we have acquired enough masks for everybody to get one, which is great. We have not distributed them yet for a number of reasons. One, I just talked about, I don't want to give people a false sense that they can go out in public, but also because we don't know if they need to be used in the healthcare setting yet. So I don't want to distribute them and then realize that we're short in the hospitals and our EMS and police. So until we have a handle on that supply, we're not going to distribute them. But also, that's a short-term fix. You can't wear that mask for more than a couple of days, if you're going out once or twice a day. So this has to be backfilled. That mask will be the bridge to a cloth mask. So something you're wearing is kind of a crude.
Crude. I think I look awesome. I was saying to Jill, I think this is a good look for me. The president wasn't much on masks, but I put this on this morning, and I'm like, dang, I think I can rock this.
So that's effective. Effectively the same as a surgical mask. I think you're going to find the private sector ramp up their capacity, maybe retool their equipment to make clothing and linens to make masks, and you'll see these masks coming out. You'll see branded masks, Nike, Adidas. You'll see Rams. You'll see all the masks you're going to want to see shortly. And once someone acquires 4 or 5 of those and they go into rotation in their laundry, that's perfectly acceptable every day to wear that mask around, and they should.
So thank you for that. That's why I put the bandana mask on, is just to have you comment about that, because that where you get these masks, and these were given to me so that I could do just what I did, put them on and show people what we've got. So this one I got out of my wife's drawer. Jill, do you have anything coming over the transept to go into the phones, as they say?
Yeah, a couple of questions. I think that people are still, we were getting some of the similar questions we've had in the past. People really trying to understand how to live day to day, particularly when the data seems to be changing about how many feet, how many days, droplets are airborne, things like that. So, a couple of questions that fall into this category of, can I use the Clorox wipes to clean packaging of grocery items, bread plastic bags, cardboard dinner packages, the Meals on Wheels meals, uncooked pasta and cellophane, things like that. What's the right routine for that? I'll just stop with the groceries and then we'll come back around to some of the other things.
So we have done everything that we can to support the grocery stores and the supply side when it gets to New Canaan, in terms of keeping the healthcare workers and the employees that are providing the service to get the food to the shelves and into your bag and home. All that's being done with gloves, with masks. We provided everything to everybody. They should be able to do that pretty effectively at this point. Doesn't mean that when I get groceries home, I don't take them out and wipe them down. Now, the problem with Clorox wipes is they're in very short supply. So at some point, what we've done is you can actually take, dilute bleach in a spray bottle, and you can get creative. Those spray bottles are hard to find also, but you can take anything that you have at home that has, make sure you clean it out so you're not mixing chemicals, but you can actually create your own solution at home and just spray it on a rag and wipe down whatever stuff you're taking out of your grocery bags. It's smart to do. It's not easy to do because a lot of items need to be wiped down, but it's smart. We'll open up like FedEx boxes and packages we get shipped. We'll put gloves on, open them outside, open the box, take the inner side box out, wipe it down and bring it in the house and leave the box outside for the trash and just never bring it into the house. So those are things you just be smart. Again, it's about risk, right? So if you had the time and the capacity to do it, definitely do it. If you don't, then you're just accepting some level of risk, and that's unfortunate, but that's, you gotta balance your time. Right now, everyone's got a lot of time, so it shouldn't be a problem.
Can you give everybody a reminder of the right proportion for the bleach solution?
No, I don't know, and I don't want to say it because I don't want to create any kind of noxious fumes in someone's home. There's plenty of sites you can look at for the right proportion.
Look it up on the CDC website, people.
And I want to reiterate one thing, because the fire marshal is going to call me as soon as I'm done with this.
Right,
You do
exactly.
not want to take a bottle of chemicals with a spray nozzle on it, dump the chemicals out, and pour bleach into it. You want to be absolutely certain what you're pouring in is not going to combine with the remains of that liquid in the bottle and create a problem. So be very careful what you're mixing at home.
We don't want you getting in trouble with Fred, the fire marshal here. That's not good. Fred's a good guy, but
Right, that's good advice. Sorry, I just lost my place. So again, questions about other things you might bring in your house, like the newspaper that's been delivered to the bottom of your driveway and your mail paper
Who gets
things.
a newspaper? I want to know who actually asked that question.
Well, to say, me too. And I'm hesitating whether I want to say this, but people who behave more traditionally, maybe because of their generation, like to still read a newspaper.
Very politically correct. I'm not the newspaper reader that I used to be. I do it all online now, so I'm the wrong person to ask. I don't know if you can wipe down a newspaper.
So I can answer it for the newspaper that lands in my driveway. They said that the first hands to touch the newspaper were likely to be mine or the reader, because it's all done, it's all mechanized, and then the person who puts the paper in the bag that gets whipped down your driveway is wearing wearing gloves. And so when you take it out, so I leave my bag outside unless I've got to use it for my cat poop, but that's a same principle.
Yeah, and they wear the gloves because they don't want to get newsprint on their hands when they're folding the paper, and always have. That's a regular practice. So, again, a question. I know there was some conversation about this on the 4 o'clock call about having cleaning people come into your house.
Okay, so this is all this all works towards that continuum of risk that we were talking about earlier. So one of the things, and I want to be very clear, it's not that we're suggesting you can't have home health aides or cleaning services coming in your home, because we know that's not unlikely, and they provide a vital service to many. But if you have someone coming into your home, you got to ask yourself, can you do that work yourself for the short term? Then you're worrying about that person's job. So it becomes a cascade effect of chain reaction of people being out of work, which is not good. But I do think you should limit, to the extent you're able to, the number of people coming into your home. And I'll give you a very good example, and this is not going to make anybody feel good, but my wife now knows how to fix the washing machine. She knows how to fix the dishwasher, and 2 days ago she gave me a haircut. So
nice.
The public is welcome to tell me what they think of my haircut, but it's things that we're learning to do on our own that we never did before. Yeah. Now, I'm not suggesting that I will never go back and get a haircut at some point when that reopens, but I really could pretty much go without it for quite some time. So again, if you can do your own cleaning, now's the time to do it. Obviously, if you need home health aides coming in the house, they should all have masks and gowns and gloves, and most of them do. We provided it to the entire county, so they should have it by now. But I would just encourage and strongly urge them to wear the protective equipment that they were given.
Good, thank you. So this question goes to what we were talking about at the beginning. So if people choose sort of to expand their family circle, maybe 1 or 2 friends, particularly people who are maybe single parents, trying to manage being, parent, teacher, worker at the same time, is it a sensible thing to make sort of a closed circuit social circle where everybody agrees to follow tight protocols, but then they have each other?
So the official answer is no. I think that's an unhealthy perspective at the moment. I think staying to your immediate circle that's, again, required and not taking additional risks is probably the smart move. The reason why I say that is because it all comes down to how strongly people follow the restrictions. So if my family decides that having Peter over for dinner every day is of vital interest to us, you're welcome to join us any day you want. But then you've got to promise me that you're seeing nobody else any other part of the day. Because once you do, that is how community spread actually happens. So it's unrealistic to think that people can actually expand that circle and maintain that circle tightly. Someone's at the grocery store. You're going to have more interactions than you really ever needed. So it's about risk. So the official word now is no, you should not be expanding your circles. There should be no play dates. Even if it's just 2 families, 2 neighbors saying we're going to stick to ourselves, it doesn't work that way. Right? Someone's got to go to the pharmacy and get their prescription drugs. Someone's got to go to the grocery store and get their food. So you're always going to have some expansion beyond that group. I've heard it with teachers, right? So, and you can do it. If people are willing, and this is an interesting concept, which, again, I don't think the town can officially support, but I think it's, teachers are out of work, or preschool teachers are out of work certainly. If someone wanted to have a commitment and pay them, a teacher every day, but to only be with their family and not go to anywhere else and not, spend their time with other families members on their side, and say just that, I get it. That's not a foreign concept, but again, you got to really trust the person you're doing that with, because if they go beyond that, they leave your house and go home and have a party, you're now bringing everything back to your house. So you got to be really careful how you do it. Does that make sense?
Yeah, absolutely.
Very complicated.
So back to a question about testing. If you think that you had COVID-19 prior to when testing was available, and your symptoms are gone, should you try and be tested now?
A lot of confusion about the testing that's available right now. So conventional wisdom would say that without symptoms, your viral load might not be high enough for the test to detect, a PCR test to detect that you actually have the positive for COVID-19. That's not always the case, and I think it's been reminded to me a number of times that people that have mono can test positive for mono for years after they've had it, even though they're not sick, because the virus does live in certain mucous membranes. So the real reason why you don't want to get tested if you're not symptomatic is because there aren't simply enough tests for those people that are symptomatic. So if everyone goes to get tested, there'll be no capacity to test people in the hospitals and people that are really sick. So that's kind of why the guidance is not to get tested unless you're symptomatic. There's a second test that everyone's working, a serological test that tests for antibodies, and that's really kind of what everyone's talking about now. It needs to happen in order to get society reopened, and that's to test immunity. There have been studies done, I read one this morning, that suggests that 30% of our country has been exposed to the virus in certain data sets, which that could be very positive at some point if it's true. I don't know if the data is actually accurate. So if you had it, and I think my family is like a pretty typical family where for the month of December and early January, we all kind of felt lousy for a week or two, couldn't explain fevers, and flu A and B were negative, and no one had strep, no one knew what was going on. But I remember saying to my wife, who's a nurse, I'm like, wow, have we ever been this sick? This is in December. And she's like, no, this is really kind of unusual for our family to be like this, one thing or another around the entire circle for a full month. So it's possible that was what that was, and we'll never know until we get tested. If I were symptomatic now, I would get tested. I'm not symptomatic, so I've not gotten tested. So I think once we get that serological testing in the community and on a nationwide basis, we'll know exactly who's had it and who hasn't. One cautionary thought. Just because you test positive for the antibodies or you've been exposed in December or January does not mean you can't get sick again. So there are instances, and viruses do mutate, so it's not uncommon, but there are instances where people have tested positive, been sick, so symptomatic in the hospital, tested, confirmed positive COVID-19, recovered, discharged, then he got sick again, tested positive again. And no one really understands kind of why that's happening yet, but it has happened. So it's not as if I knew I was exposed, I just go to the Yankee game all of a sudden because you can't get sick. It's not necessarily that simple.
So that's a big piece of information that you haven't said before in our 6 weeks. There was a lot of question marks around that. If you were part of the lucky club, I got it, I didn't experience anything, now I have the antibodies, and now I'm Superman or Superwoman. You're saying not so.
No, I'm not saying yes or no. I'm saying there is evidence that supports people can get reinfected and sick again. And no one knows if that's a different strain or they were always going to test positive without symptoms. No one really understands. I haven't, at least someone might know. I don't know. And I haven't seen it before. Just like they said it lived on cardboard and hard surfaces for 3 to 5 days, we know that's not the case. So I think it's unfair to criticize the science because it's really kind of new and we're kind of learning this as we go. So I think the best thing we can say is stay isolated, even if you're recovered. So if you're recovered, there is something that you can do. So therapeutic plasma donation is a huge turning point for this country. So, and again, the science is early to know if it's actually going to work, but there's no reason not to do it. So if you actually have been confirmed positive or sick, got better, then you should give the health director a call in New Canaan and offer up your services for donation of plasma. Because that plasma is being directly administered back to someone in the ICU in the hospital, and they're showing some mild success with that program. So that's a therapeutic that we can use, and God bless us, we've got enough people in the community that have been positive. We can take that and run with it.
Wow, that's really interesting. One of the things that has not risen to the level of our conversation has been just the need for blood in the United States,
So that's a tough one, right? This is not. I mean, there's always going to be a need for blood. I'm not close enough to the Red Cross to know what the demand on the blood banks are, but there's a lot less trauma today than there was in the last 20 years, a lot less elective surgeries in the last 20 years, so there should be less demand on blood. I have not seen, and I'm not a doctor, but in the doctors that I've spoken with in the ICUs, there hasn't been a huge demand, COVID-19 related illness that's demanded blood. Certainly it's affecting the entire body systems, kidneys and liver, a lot of dialysis.
Right.
But I
Right.
think there's always a need for blood, but again, giving blood is exposing yourself to a risk going out in public to give blood. So I'm not sure how to balance that.
Yeah.
No one has called me saying there's a shortage of blood. And if there were, then I would start to encourage more donation, but I haven't seen that yet.
Yeah.
A lot of people have called to offer and said, how do I donate blood?
Oh, no kidding.
Which is
Wonderful.
nice.
So I'll just say we are a regular Red Cross blood drive site 6
here?
times a year. It happens right in this room. And they are expressing that there's a critical shortage of blood because almost all of their drives are canceled because most of them happen in places that are too small to have social distancing of any kind. And so that's actually a question that I have, which is that, everybody's trying to look for ways to use what they have to help the cause, right?
Yep.
And so is that something that we should be considering here? We have a big room. It's empty all the time now. Is that is the helping out the Red Cross something that's appropriate to consider?
So that's the first I've heard of a short. Obviously, we know the supply is going to be short because no one's donating blood because there's no sites open. But it's the first I've heard in a month and a half that there's actually a critical shortage of blood in the U.S. So if that's the case, then we can certainly think about the way to tolerate the risk, but make it the lowest risk possible to get that done. But it's first I've heard it.
Okay, that's good. Sorry, I just lost track of that. Okay, so, here's a question back to this sort of how can we deal with our family unit. A family has their grandmother living with them, a senior, and, they've taken her out of her communal living environment, and 2 siblings are having mom stay with them 2 weeks at a time. So 2 weeks at my house and then 2 weeks at my brother's house. Everybody's isolating except for going to the grocery store. And does that seem reasonable or not a good idea?
So, I think everyone's got to make their own decision. I think it's only human nature to want your loved ones around you when there's something like this going on. I also understand and appreciate that having a parent live with you full-time, forever, as it feels, is a challenge, and everyone's home is different. Some people can tolerate it, some can't tolerate it. The 2-week switching back and forth, I suspect it's that if someone develops symptoms, you're not sending someone back. But I hear this all the time. We're quarantining. Except for, there's always an except, right? So there's no such thing as an except for. So you're either quarantining or you're not, and there's some level of risk you're taking. So, my concern is, if one person, develops symptoms in that house, that transfer should not happen, right? So if someone develops symptoms in the house, the whole house should be locked down, and they should all self-quarantine to the extent they're able to. And they shouldn't, if 2 weeks, if we're 10 days into the 2 weeks and, the son gets, symptomatic, 4 days later, you don't send mom back to the sibling. So you just got to be mindful of the symptoms. Now, one thing we are seeing, and there's no way around this, I think I mentioned this before, we're seeing infection rates among households. 100% of the house is going to get it. And that's not surprising. It should not be surprising because, and I don't know why it's happening. I suspect it's because you can't truly quarantine someone in their room forever, so sharing a bathroom, delivering food, and that's the obvious, suspects. There's some that are less obvious that are more concerning, right? If it's because 2 adjoining bedrooms, if the 2 occupants of the bedrooms never leave their room, but they share a ventilation system, is that what's happening? And that would be a concerning. If it's airborne and ventilation, that might explain why the cruise ships are getting, the high rate of incidence they have. Why battleships and military ships are getting the same high rate of incidence. If it is airborne, and again, I'm not suggesting that it is, I think it's more likely that it's probably the tray of food outside the door, someone's not being careful, or they're kissing someone goodnight, or someone's having a tough time and going to take their temperature, which is what I would do in my house. That's how that infection is spreading. But we're seeing one person positive in a house, the whole family's got it. So again, to your question, Joe, if they're really mindful of their symptoms, I would not be transferring someone from one house to another if there's any symptoms in either of the houses.
Okay. Well, I hear the bells. Should we pause here? Or?
Yeah, just as we wrap it up, Mike, I want to say again thank you to you, and with my sister in my head, to your wife. Thank you to the team that you work with. It's a very big team. It's a very good team. You'd mentioned Jen and I. Kevin, our first selectman, seems like he's still firing on all cylinders. He looks good. I would say that this is, back to this, it's not a sprint, it's a marathon. No, it's a triathlon. Our prayers and well wishes are for all of you and your health. And to see as we move into the next phase that wisdom might visit all of our communities. In the Bible, wisdom is lady wisdom. Wisdom is female, and that wisdom might come to us, so that as we begin to unfold to figure out how to live with this over time, that we might do it in a way that is wise, that is for the common good. And thank you so much for your sharing about everything from these masks to risk profiles. And we're grateful for your coming, and look forward to seeing you next Sunday. Sunday Mornings with Mike, it's the highlight of my week here. But my wife did say to me, is he keeping good hygiene? You're sitting 6.5 feet away from him. So I love it that on my end, my wife's saying, I don't know. Yeah. Anyway, peace and blessings to you. God bless you, and thank you to your whole team.
Thanks for having us.
For all the leadership that you do. Just incredible leadership in our community.
Please stay healthy.
Yes, you too. Okay, everybody, same for you. Stay safe, stay home, be well.